Hey, can you hear me?
We can hear you.
Okay, thank you. Welcome to a Gold project, an Erasmus Plus project aiming and sharing good practices for old age people. Let me share my screen. I don't know if you've been hearing me previously, but I will present on behalf of Charlotte and all of the partner consortium, the Gold Project, a project aiming and sharing good practices for healthy aging. Some words about us before I begin. Charlotte is an NGO based in Athens, Greece. We use game-based methods for education and inclusion. Some of our related projects on the dementia environment would be BRIDGE and T for All, a project aiming intergenerational activities, and Progress, a project aiming at reducing aggressiveness as a behavioral symptom of dementia. And for sure, the goal, the project that we are you will be introduced to it shortly. And also, we are focusing on creating barrier-free cultural environments for people with facing additional difficulties such as dementia or hearing disabilities. So let's jump now into the Gold Project, an overview of that. And it is ending in February, so it was a 30-month project. We as a Challenge were coordinating this project, our partners from Greece who are reading from others and Sordizo. Whereas from France, we had the Association in Senior, from Bulgaria, the Association Generations, and from Germany, the University of Münster. All of us brought our a very interesting palette of intergenerational activities and also created many results for you to exploit. Our target groups were people aged over 65 years old, health professionals, or caregivers of old age people in general, care organizations, nursing homes, and other relevant professionals such as social workers, psychologists, educators for sure, and other professions. The aims were to promote activities for healthy aging, enhancing the visibility of old age people in social activities. We would like, with very interesting activities, to maintain and improve all their capacities, either mental, physical, and social. We want to reduce the stigma of ages, and we want to bring out their will to be able to offer and be able to participate in fruitful intergenerational activities, transferring their knowledge to other generations. So, as I said before, we had an exchange of best practices on several issues of what might be considered healthy aging, either being active in social environments or maintaining your health, exercise. We also explored Europe-wide such activities, and would like with this with our results to expand the skills of all the trainers or staff of care organizations and strengthen also other skills that might be not that prominent, such as the digital participation of old age people and for sure diminish stereotypes about old people in general. We had four project results. The first one would be the mapping of the status and need of old people. We collected best practices Europe-wide, but also we presented in a very coherent way best practices that we as partner organizations implement in our facilities. And we created some short videos sharing our experiences from our Gold best practices. All these results were created in trainings and tested in trainings or in online meetings in order to coordinate all the results that had to be completed. And now we'll jump onto the results. The first result, as I said, it was a guide mapping the situation and needs of all people in each partner country, that is Bulgaria, Greece, France, Germany. We did the desk research on issues affecting life expectancy of all people. What is the number of the population? What are the main causes of death? What is their economic status? What is the social care status in each partner country? Are there any public facilities, or are many private facilities? And other main issues that all these people might face. So we can see that many of the participating countries are above the median life expectancy years in Europe. I will briefly pass all these issues. The share of people over 65 years old is increasing mainly in other partner countries in the last decade. There is a cost overburden for caring for old age people. Greece, of course, has the greatest share, whereas some other participating countries are around the median Europe. What are the causes of death of old age people worldwide? The majority was the circulatory diseases, followed by cancer, and a great category of other issues such as mental and behavioral disorders and other diseases in general. So I will quickly pass all this stuff because you can see that. Also, we did a research on the profile of carers, if they are professional or informal carers. What are they working or not? So we wanted with this information to research on activities that they could implement either as professionals or informal caregivers. As conclusions, we found out that main issues that all people face were mental health disorders, lower income. For sure, they were socially excluded. They would like to be active citizens, but we have to promote this dimension to the whole society. They found some difficulties in using ICT, and they would like to find more ways on promoting the quality of their life. So, yeah. So what we found out as well was that they would like to be supported and stay independent in their own homes. They would like to have equal and efficient access to healthcare, public, private. They would like to be continually included in engagement, their hobbies that they had as young ones, or socializing and traveling. And there is a need for developing programs for raising awareness about the need of old age people, about active aging, and also advocating for their rights and promoting difficulties that they may face. So we jump now. We're inspired by the findings of our first mapping guide, and then we try to find out best practices implemented from organizations other than the consortium that focused on mental and physical health maintenance or nutrition, or to reduce the risk of poverty among all people. They would like also to be active in their work, so we would like to promote activities that they empower them to be active as long as they like to be. We also found best practices on digital inclusion and digital education. And then the third guide or third results would be good practices that we implement as organizations, the partner organization of Call Consortium. You can find in this guide detailed descriptions on what these best practices are. I will elaborate more on that in the slides to come, and also some tips and tricks on how to implement them. The findings were these best practices, I'm sorry, are also presented in very short videos available in all partner languages that are uploaded on YouTube. And now we will jump to what are these gold practices? What were these best practices that we implement as partner organizations and inspired us to join our forces as a consortium and research and create results in order to promote more people in the field of active aging, health aging. I'm sorry, to implement or get inspired and create their own. We will begin with activities to implement as organization. We have started, as I said before, we use game-based solutions for education and social inclusion in game jams, in the bridge game jam that follows, that it was implemented with the help of Alzheimer Halkida. Of course, we had the game jams in Athens and Halkida. They are events where people come together and design games. The particularity of these events were that we had also people with dementia, their carers, and we co-created all together games for them, with them. They tested the games, they evaluated the games, and this a very nice initiative. You can see some images from the game creation workshops. And this very nice initiative inspired us to make our first step in Erasmus Plus projects, creating the Bridge project, which is also a project aiming at creating games for people with dementia. For sure, we had partners Europe-wide, and we had many results that would facilitate our effort to create games. Together, the partners were the Panhellenic Association of Alzheimer Disease Greece, the University of Western Macedonia, and two partners affiliated with Alzheimer Care in Italy and in Romania. Together with them, we created a methodological guide for game designers to understand the needs of people with dementia, for professional carers or informal carers to learn on how they can create, co-create with their loved ones games or involve them in playful activities. It was a more systematic approach. We had created many games, you can find them on the, and also we had created a MOOC accumulating all this knowledge to everybody interested. You can find all these games on the Bridge project. We will jump now to the best practice of Rodizo. It was, we will present the home care program that they offer together with Timo Foundation, funded by Timo Foundation. It is within this program, they would like to train family caregivers and counsel them on how to manage the caregiver burden and on how to provide care at home for their relatives, family, friends that they suffer from dementia. And also they implemented seminars for family caregivers. We will jump to the next best practice that would be an exercising best practice that for this on University of Munster had implemented together. That could be Actimentia, that it's an online training platform for people with cognitive impairment or dementia that they can use and exercise daily. Either it can be used for from formal or informal caregivers, and It promotes overall the well-being of all people, healthy or demented ones. We will jump now to our partner in Bulgaria, Association Generations. They have created a short 5 educational curriculum for VET education, promoting careers in assisted living, either being an architect of assisted living environments or a developer or manager. A very interesting initiative, of course. Also, Association Generation promoted an activity on a project on how on a healthy diet and physical activity for all people by creating any platform for anyone interested in following this path in his life. And also they also Association Generation created women, a project that aims to empower women, old women that are excluded from the labor market by providing guidance to them and also providing educational material for career counselors and by training soft skills of these women. We jump now to the reading for others best practices that they are audiobooks for people with disabilities and also therapeutic trainings at all people where children, young people narrate fabulous fairy tales to old age people, and they are reading for others. Here's also an activity on therapeutic things for many people facing additional difficulties. So this was a very short presentation of our core best practices. You may find more information on a video that we have released on YouTube explaining more in detail all these best practices. We hope we made a good project and I will be available for any questions if you would like, you have one. Thank you very much.